but it should.
There we go. Awesome. Thank you so much.
Thank you all so much. So Lindsay, next slide, please. So we are now recording today's session. If anybody's got any questions, please drop them in the chat or pop your hand up, and we will either answer them in the chat if it's something that we can answer quick and easy, or bring one of our guest speakers in to answer at an appropriate moment towards the end when we've got questions and answers. Oh, Sean can't hear anything. Can other people hear? Yeah.
Yes, we can hear.
Yes.
Donna, you had your hand up. Is it an error? Don't worry. Sean, can you hear us now? Thank you, Wendy. That's reassuring to know. Lindsay, can you just pop a message in the chat saying for people that can't hear us, they might have to disconnect and rejoin? Is that okay? Thank you. Thanks, Donna. We'll just wait for Lindsay to write that message, and then we'll just get these couple of people to come out and come back in. Thank you. So we are going to be using Slido today. For those of you that might not have used that before, it's an interactive questioning tool that we can use to help us with an evaluation of the session. So Kirsty is going to very kindly pop a link in the chat that you can use to access Slido, or if you've got a smartphone with you, you can just open it onto the camera now and use the QR code at the bottom to scan it, and that should give you access to the questions. So if you want to just try doing that now for me, please, and then we'll move you on to the next slide, which will give you the first question, as well as it may already be in the chat. Thank you. The QR code's also in the chat as well. So Lindsay, do you want to just pop to the next slide, please? So the first question that you should be seeing is, how confident are you in knowing what your blood pressure numbers mean? So if you could just take a moment to think about that and answer. And then Kirsty, you let me know how long people usually need for this part before we move on to the second question.
No problem. There's quite a few people already voting, which is brilliant. We're at 20 people already, so keep them coming. That's really good. And just for people's reference as well, once you click that link or scan that QR code with whatever device you're using, as I prompt, or Laura prompts, that we're going to ask another question, it's exactly the same link and exactly the same QR code. So if you've got that open in the background on a device, it will automatically move it on when we prompt that we're on to the next question. So you don't need a different link or a different QR code. It will automatically change. So it's really handy. You'll just relook at your screen again, and it should have moved on to the next question when we move it along. So we're at 26 people now, so that's really good that have voted. We'll just give it another minute, and then I'll move it on to the second question before we start with Emily's video. So I'll just give it one more minute. That's great, Debbie. Thank you for that. If you could do it separately, that would be great if possible, just so we can get a true picture, but no problem at all. If not, that's absolutely fine. So we're at 28 now. So I'm going to move it on to the second question. So just
Clear.
So you should now see question 2, which is, have you had your blood pressure checked in the past 12 months? So that should be the question that you're now seeing via that QR code and that link, however you've got that open on whatever device. So if you could just take a minute to answer that for us, that'd be great.
Thanks, Kirsty.
and they're flying in with the answers for that as well. So we're at 25 already for that. So if you want to, people can continue to answer that in the background, or you can come back to it later. If you want to move on, Laura, that's absolutely fine.
Perfect, will do. Thank you so much. So we are now going to play a welcome video from Emily Turner, who is our Cardiovascular Disease Prevention Clinical Lead for West Yorkshire. Go ahead, Lindsay. Thank you so much. So Emily works really hard across the whole of West Yorkshire to try and ensure that everyone is looking after themselves, getting the blood pressures checked regularly. I'm really sorry for those of you that can't see or hear the video. I don't know, again, if you might need to rejoin. I think that's helped Sean's issue with not being able to hear, so that might be an option. If you can hear me with that instruction, Lindsay, it might be worth just reposting that instruction again for anybody that will help. So thank you so much. Moving on to the next slide then, please. So I would love to welcome Eben, who is our South Yorkshire CVD Clinical Lead for CVD Prevention Clinical Lead. You are, Eben. I'm sure you'll do a much better job of introducing yourself than I will. Thank you so much for being here today. Handing over to you now.
Thank you. Can I check that everyone can hear me all right? First of all, thumbs up. Excellent. I can see some people nodding. If I start to speak too quickly, let me know. I'm hoping I can keep up with my slides. So hopefully I won't move too quickly for you. So yes, my name is Eben Ojo. I sort of do what Emily does, but in South Yorkshire. And I share my role with a GP from Doncaster as well. So I've got some support. Yeah, so I'm hoping to just very quickly cover what is blood pressure. And I'm hoping that I'm able to explain it in sort of terms that actually makes it really relatable and also helps it to stick, so that when you're starting to think about your care, when you're starting to think about how to, what exactly it is that, the healthcare professional is doing or is talking about when they're trying to check your blood pressure, manage your blood pressure, I think hopefully it makes it a bit more relatable. Next slide, please. So what is blood pressure? Imagine you're at an airport and you see, there's conveyor belts that carry luggage from check-in to the airplane. Now, think of your body as a big airport and your heart is the control center and your blood vessels are the conveyor belts, but rather than carrying luggage around, it's carrying blood that's delivering oxygen and important nutrients to your body. Blood pressure is actually the force that is felt by your heart and your blood vessels when blood is passing through, kind of like the pressure on the conveyor belt while luggage is on it. So if you think about it in that sense, okay? So next slide, please. So if your blood pressure is when your heart beats, it's like the control center giving a strong signal to the conveyor belt to move faster. And then when it rests, it's basically asking it's a quieter signal to slow down a bit. And the blood pressure is the force when your heart is moving really quickly, and then also the force when it's having that quieter signal. Next slide, please. So obviously, when you do check your blood pressure, what you do have then is these two numbers. That top number there, sorry, can you just click on Lindsay? So the top number is the pressure when your heart is pushing and, it is trying to force blood through your blood vessels. And the bottom number is the pressure when the heart is resting, when the heart sort of isn't sending that signal to push anymore. What we expect to see is sort of like a slight, what we expect to see is that the heart is not under too much pressure when it is pushing, but then when it's also resting, actually it does look like it is properly resting. So if you think another way that we represent blood pressure is this 136/89. So the top number again is the pressure when your heart is pushing or sending that signal to push blood through your blood vessels. And the 89 is when it rests. And if you can imagine, your heart does that many times in a minute, like sort of like that pumping and stopping rhythm. And what we want is for you to have, what we want is sort of like a normal blood pressure. That means that the heart is not under too much work, because we'll go on to see that there are issues associated with uncontrolled blood pressure. But then before we do that, we'll actually look at some of the risk factors for high blood pressure. Next slide, please. Next slide, just click through. So normal blood pressure, what we're looking to do when we are talking about or when we're managing blood pressure is we want your blood pressure to be within a certain range. That tells us that your heart is not doing too much work. So normal blood pressure, we want the pressure when your heart is pushing and sending that strong signal to be between 90 and 120. And then the pressure when it's sending a quieter signal for it to be between 60 and 80. That's what we consider to be normal blood pressure. Now, if you've never had a diagnosis of high blood pressure, then if your blood pressure is between 120 and 140 for the top number, we would probably want to review you more frequently, because that for us might look like, a pre-high blood pressure reading. If you already have a diagnosis of high blood pressure, then anything less than 140 is what we would be aiming for. Okay, so I know, this is just particularly for those who have a diagnosis of blood pressure. It might look like, my blood pressure is not less than 120. That's fine. You're probably on medication or making changes to try and lower your blood pressure. So make sure it's less than 140. So that's good. Just continue with that, and you will continue to be monitored regularly by your healthcare professional. If you don't yet have a diagnosis and you find that your blood pressure is sort of within that 120 to 140 range for the top number, or 80 to 90 for the bottom number, then you might need to, see your healthcare professional a bit more frequently, just to keep things under control. Now, anything over 140 for the top number and 90 for the bottom number, we would consider to be high blood pressure, because it means the heart is having to do a lot of work to be able to do that, to be able to carry on with that pumping rhythm. Now, as you can imagine, in terms of some of the consequences of your heart being under that much pressure for a long period of time, one of the things, the classic signs is the heart muscle tries, it starts to get a little bigger because it feels like it needs more muscles to be able to manage that blood pressure. The problem with the heart, however, is that when it changes its structure to build that muscle, it actually gets less flexible. And that's when we start to see some of the problems associated with uncontrolled hypertension. On the converse side of things, if the blood pressure is less than 90 for the top number and less than 60 for the bottom number, then it's actually not doing enough to push blood around the body. So that blood pressure would be too low. If you imagine it, it's like the conveyor belt moving too slowly at an airport terminal. That would be chaotic. So you won't get your luggage on time, and that could cause problems. So just same way, a blood pressure that is too low, it can cause problems. So symptoms like feeling very faint and lightheadedness, and it can also go on to cause even more serious consequences as well. Next slide, please. So risk factors for high blood pressure. Next slide, thank you. So older age is one of them. Unfortunately, as we go older, our blood vessels have been around for a very long time. And unfortunately, what that means is our risk of developing high blood pressure goes up. Kind of like the same again with the conveyor belt. That's not been changed for years and years and years and years and years. It's not going to be quite as good as moving things along. So older age increases the risk of high blood pressure. Same with genetics. Now, that just doesn't mean family history, although if you do have a family history of high blood pressure, then yes, there is a chance that there might be something associated sort of genetically in terms of the family history, but then also just your own makeup in terms of existing conditions that predispose you to high blood pressure. So some people, for example, that might have things, other conditions, for example, an overactive thyroid can increase your risk of hypertension. So yes, the genetics can have an impact on your risk of developing high blood pressure. Excessive weight. The more weight the body has to carry around, the more work your heart has to do to get oxygen and nutrients to all the different parts of the body, putting more pressure on the heart. So excessive weight does increase your risk as well. Similarly with diet, diets that are high in fats and high in salt have an impact on our blood pressure. Because the more salt we eat, the more water we absorb, and that means it's more volume for the heart to pump around the body. Similarly as well, lack of physical activity, exercise, sort of, especially, sorry, I'm not moving fast. It's going on without me, the slides, so I'll catch up with the slides, not to worry. Exercise sort of serves as a secondary pump mechanism for the heart, especially exercises that that involve walking. So if we're not moving very much, that can also increase our risk of high blood pressure. Similarly as well with smoking and alcohol. So smoking, alcohol all contribute to things like narrowing of your blood vessels. If you think about it as anything that narrows your blood vessels, means that the blood is having to pass through a smaller lumen to be able to get around the body. But then if you now think about the fact that if you have a combination of one or more of these risk factors, that globally increases your risks even more. And I put a picture here of an obese, older individual smoking and drinking alcohol, just to give you an idea of how that blood, having multiple risk factors, again, actually has an additive effect in increasing the risk of hypertension, high blood pressure. Next slide, please. So, like I said earlier, if you think about high blood pressure as your heart, and if you think about it in the context of a conveyor belt moving things along, if the conveyor belt isn't, if it's having to do a lot of work, carry a lot of load for, all the time, every day, continuously, there'll be wear and tear that can affect the functionality of the conveyor belt. Similarly, as well, in terms of the speed at which it's having to move, all those things will have an impact. And again, it's the same with our blood pressure. If your heart is functioning at high pressure for a prolonged period of time, that can have consequences. Now, some of the consequences we're very familiar with, because we talk about them all the time, like heart attacks and stress. Can you just click through, please, Lindsay? Yeah, so, we talk about heart attacks, we talk about strokes. Those are ones that we're familiar with, but heart failure is one that some people might not be familiar with. And again, I'm going to have to catch up with my slides, but just to explain what I mean by in terms of heart failure, is basically your heart unable to keep up with its function, and that's because of its lack of flexibility. But again, though, increasing your high blood pressure also damages your kidney, because it's pushing a lot of volume, constantly through your kidneys, and eventually it makes it very hard for the kidney to be able to keep up with its function as well, resulting in chronic kidney disease. So again, this is something that people might be familiar with, and you'll find that, eventually not only do you have high blood pressure, but you also develop chronic kidney disease. But there is actually a direct link as well. Yeah, thank you. Eye damage is another. Sometimes, for some people, we don't, one of the signs of high blood pressure is eye damage. You've gone to see the optician says, oh, it looks like you've got a damaged blood vessel, which is usually a sign of high blood pressure, and that's when you just find out that you've got high blood pressure. But just to give you an idea, it's, high blood pressure affects all of the blood vessels in your body. So yes, it can cause a heart attack or a stroke, but it can cause damage in other places as well. Can you click on please, Lindsay? So again, erectile dysfunction, this is another one that's not well sort of publicized. It is, it is publicized with things like diabetes, in terms of the associated side effects of having diabetes, that erectile dysfunction could be a consequence, but actually high blood pressure, uncontrolled hypertension can also cause erectile dysfunction. Click on please. Similarly, for women, if your blood pressure is not controlled, that can have an impact on pregnancy and things like preeclampsia and being able to carry to term, carry the baby to term. So that's another another impact of uncontrolled hypertension. And lastly, peripheral artery disease. That's sort of clinic term for damage to your blood vessels in your lower extremities. Again, high blood pressure causes damage to your blood vessels, kidney, eye, heart, but also in your legs. So people who then develop problems with walking, with walking, because you've got what we call claudication in your legs. So, when you try to walk a distance and you develop pain in your legs as a result, that's peripheral artery disease. And again, if you've got uncontrolled hypertension, that can cause damage to the arteries in your legs and increase your risk of things like limb loss, for example, if you're not getting enough blood flow to your legs. Now, it's a really grim place to sort of stop the conversation. But I think it helps to highlight the fact that while hypertension might seem like it's just trying to treat a number, I'm hoping that I've been able to help you see that actually it's not about treating a number. The number is helpful for us to know because it tells us where the goalpost is and what we're trying to achieve. But understanding that what we're trying to achieve is make sure that the heart, we only get one heart. We only get one set of blood vessels. Unlike a conveyor belt where, you know, you can service it and maybe change the conveyor belt when it's worn, we don't necessarily get to do that. So we've got to make sure that we can maintain these structures for the entirety of our lifespan. And part of doing that is making sure that we keep our blood pressure in a healthy range. So I think, can you still hear me? Brilliant.
Yes.
So I think something's just happened there with my internet connection. So it's important to engage with your healthcare professional when it comes to managing your blood pressure, making sure that you're keeping on top of your annual review for your blood pressure, but then also managing it as well on your own. So whether that means having your own blood pressure machine that you use to monitor your blood pressure once a week, once a month. Obviously, it's not about checking it every single day. And again, like I said, it's not about treating a number. It's understanding what a healthy range is and making the decisions to make sure that you're able to keep your blood pressure in a healthy range. And if you go back to a few slides ago when I was talking about some of the risk factors, kind of tells us what changes we can make, because some of those things we can't change. We can't change the fact that we'll get older. We can't change the fact, we can't change our family history, our genetic makeup, but we can change things like our physical activity, alcohol, smoking, and our weight. So I'll stop there because I think we've got some really great talks coming from our peer leaders of some really great lived examples. But I'll stop there, and I'm happy to take any questions either now or at the end of the presentation.
Thank you so much, Eben. I think if people can pop their questions in the chat, just because we're tight on time, if there are things that Eben can answer whilst other people are talking, I'm sure that she will. And if not, we can try and pick up questions at the end if we've got some. So Lindsay, on to the next slide, please. I'm just going to introduce Sean now, who's going to share his story of lived experience with us.
Yeah, good morning. Hopefully everybody can hear me okay. Yeah, I've got quite an interesting blood pressure story to tell. Probably demonstrates all the things that people advise you to do to make sure you get it measured and control it in the meantime. But if you could move on, Lindsay, that'd be great. So from my story, hopefully you'll be able to see why the blood pressure monitoring is so important, and also what could have been done differently in my case. And I do look back and think, well, actually, if I'd done things differently, would have actually prevented what actually occurred, which I'll talk through later. And then why it's so important. I had no idea of numbers, even though I'm a scientist. But maybe if I'd been given an indication of how important it was, maybe I would have done things differently. But being a middle-aged bloke, I ignored most of it, if I'm honest. Next slide, please. So I thought it'd be just useful to tell you a little bit about myself. I'm 59, or as my wife likes to say, actually, you're not 59, you're 60 next year. So I'm trying to enjoy my 59th year. I've always been a keen cyclist and very much loved to travel. But I had my own sales management company, consultancy business, dealing with pathology, diagnostic companies, and ultimately dealing with the NHS. And it was dealing with large management procurement teams and private labs and customers from the diagnostics industry. So you can imagine I was under a lot of stress, a lot of strain. I was visiting and dealing with customers, not just my customers, but their customers. Also, just the logistics of running your own business, trying to be in 3 places at the same time. So ultimately, it was a lot of hours, lots of traveling, emails late at night, responding to clients and customers. So hopefully what I'm trying to do is set the scene. I was busy, busy, busy. And then this leads on to my story. So if we can move on to the next slide. How did it start? Well, basically, I was exhibiting at the Public Health England conference at Warwick University in 2018. And I was admittedly with a colleague, but as you can imagine, setting it up, it's quite stressful, making sure everything's there, making sure all the logistics are correct, physically bringing stuff in. Had to deal with a number of customers' phone calls before we actually commenced the exhibition. I did develop a headache, but I put that mostly down to stress, and it was also a stuffy atmosphere. But what there was at that particular conference, a large number of occupational health companies who were just carrying out routine blood pressure and blood glucose checks. So I thought it'd be a good idea. I'll just have a wander onto one of their stands, get my blood pressure checked. First one said, "Oh, it's high." So I just basically walked off. My thoughts were, oh, maybe the machine's not being calibrated. That's my science background. Maybe the reading wasn't representative because I'd been rushing around. I was a bit under stress. So I thought, well, I'll try another company. It was quieter, so I felt in my mind I was a bit more relaxed. I was told it was very high, despite not being given the numbers, and I should book to see the GP immediately. I was actually quite dismissive. I haven't got time. I'm exhibiting here for 3 days. So I did go off, but the lady came, looked for me, and she emphasised how important it was to get a GP appointment booked. Didn't know any numbers or significance. So that was basically the start of my journey. Can we have the next slide, please? So what did I do? Well, I did go to see the GP a little bit reluctantly. I was told the blood pressure was high, and basically gave me a prescription for blood pressure medication. I'd come back in 3 weeks. No sort of discussion about monitoring or anything. No discussion about figures. But what I was experiencing was continuing high blood pressure and also increasing breathlessness. And this went on for about 9 months. My medication was increased. I was also given an additional tablet. I was going backwards and forwards all the time. I was basically told to relax, which was a little bit difficult in my line of work, but I tried to relax as much as I could. I did put it down to stress and asthma, and I wasn't actively encouraged to self-monitor. And with hindsight, that might have been a better thing. I might have been able to pick up a better picture of what was going on. And because I was self-employed and I wasn't feeling right, I'd actually decided I'd got the luxury of being able to decide to take the spring and summer off. Basically, in my mind, I thought just de-stress, relax, and that would sort the problem out. And I did plan and train to cycle the Cheshire Ring, which is a 100-mile bike ride around Manchester. As relaxed as I have ever felt, but my blood pressure was still high and under certain circumstances going up. And this breathlessness started to get worse. My peak flow was reasonable, but it was up and down quite a bit. So I just put it down to that. And again, I was told to relax. But at this stage, I was starting to get a little bit suspicious, as my father had a heart attack in his late 50s, and his symptoms were breathlessness, and it was only detected because it was actually a silent heart attack, and it was only detected after a process. Everything else was dismissed. And I did raise this with the GP, but he dismissed it as not being cardiac and issued me with a new inhaler for my asthma. Can I have the next slide, please? So, apologies for this. There's nothing worse than middle-aged men in Lake Rab, but we had our 3-day bike ride doing the Cheshire Ring. what was peculiar was from this being given this new inhaler was I started developing discomfort down on bottom right hand side of my abdomen. And what was very peculiar about it was if I actually warmed up and was able to cycle, I could, and took it nice and steady, I was able to break through this after about 20-30 minutes, which I just thought it was a case of this new inhaler settling down. This first day really struggled, but broke through it, and after 43 miles I actually finished the stronger of the four of us. Second day I couldn't break through this, and I'm quite relieved that a friend of mine had actually decided to drive that day. So after 10 miles I put my bike in the back of the car and drove around with him, and then the third day fortunately it was downhill into Manchester. Next slide please. So rather reluctantly and with a lot of pressure from my wife, I was persuaded to make an appointment to see the GP. And actually my GP is only 5 minutes away, but on the way down I experienced this severe discomfort, probably the worst it's ever been. And when I saw the doctor, the same one I've been seeing for the last 9 months, he did give me an aspirin, and he did say, I'm going to send you up to A&E for an ECG, but no explanation about what was happening, what was occurring. In my mind, it was precautionary. When I did look back, he actually listed I was having a cardiac event. He did then put me in a room on my own with no windows. Wasn't briefed at all. It would just basically wait there while we wait for the ambulance to take up for the ECG. Looking back now, the reception told Yorkshire Ambulance Service I was having a cardiac arrest, but also in the same breath said I was fully conscious. So clearly I wasn't. All the paperwork said the doctors was present and there was a defib, but actually, again, that wasn't there. There was no obs taken, no ECG taken. Now, fortunately, I found my wife, who is an ex-nurse, and immediately came in, saw me, and apparently my colour was pretty awful. And her nursing instincts kicked in, and she took control. She redialed 999, asked for the doctor, but again, no one came. She asked for the defib. But again, that was fairly slow. We eventually did get one, and also at the same time, a doctor did emerge, not the one that had been dealing with me, and he walked straight past her. He did look in the room, but his explanation was everything seemed to be under control. Besides, he wasn't on duty, which was a disappointment. Next slide, please, Lindsay. Now, fortunately, the paramedics arrived at that stage, and ultimately I was diagnosed with a heart attack with 100% blockage in my right coronary artery. And my journey I ended up with 2 cardiac procedures. I don't know if anybody knows, but I've ended up with 8 stents being fitted, which is basically inserted into the artery and opens up the artery to remove the blockage. As a scientist, I was quite fascinated to be able to watch this on TV, and the cardiologist did show me the before and after pictures, which again is quite interesting from my perspective. Might not be the way that I really wanted to see that. So since then, I've really sort of changed my life. Can we have the next slide, please, Lindsay? Oh, sorry. I mean, obviously, emotionally, it was quite a roller coaster for both myself and my wife. If you can just run through them, Lindsay. I definitely didn't feel cared for on the day. I wouldn't say I was frightened or scared, but my wife certainly was. It was quite bizarre that I did feel to be a burden on that day. And to a certain extent, just to be stuck in the room on your own, you feel worthless, feel quite vulnerable. I'm guilty. The guilt was more around the fact I'm one of these guys that doesn't like any fuss. I didn't want to put my wife through all this, so I felt very guilty. We were all supposed to go to London that day, so again, felt guilty we had to cancel that. My wife was very angry, incredibly angry, especially because I was left to defend, or we were left to defend for ourselves. And then once things settled down, you start thinking, why? Why would a GP put you in a room on your own? Why would I be just left to fend for ourselves? Why did a GP walk straight past when it was clearly my wife asked for help? And our motivation is we've never wanted this to happen to anybody else. So we did take it further. We did complain to the Ombudsman. It did basically sort of pass to say, yes, they did fail on communication, which I felt actually wasn't really the point. But I will be honest with you, once we hit cardiology, the complete opposite of that, we felt cared for, valued. I was always a key part of the decision making. Communication was superb. And because of that, I've managed to change that round. Next slide, please, Lindsay. And I've really got a positive. I do actually view my heart attack as a positive event, bizarrely. I do exercise more regularly now. I've treated myself to an e-bike, which has been fantastic. I have done numerous long distance bike rides. My recent one was the Hebridean Way, which was quite tough because the rest of the country was in beautiful sunshine and we were fighting gales and heavy rain. So it was quite a challenge. I enjoyed the challenge. I do eat a lot better. I wouldn't say my diet was particularly bad before, but I am consciously eating more oily fish, cut out salt to the point where now if I go out and eat in a restaurant, I find things very, very salty, more conscious of the right fats, switch to olive oil. And also what I do is I actually cook from first principles, so I do know what's going in there. Heart attacks are quite motivational to lose weight. I did lose about 2.5 stone. I will be honest with you, I put a little bit back on. And then if we can just move on, Lindsay, the whole point of the exercise is I do actually routinely monitor my blood pressure now. I try once a week. If I'm under a lot of stress, because I still do work, not to the same extent, I will check it. And I am a scientist, I do like data. I do enter it into an app, so we can look at the trend. Is it starting to go up? But it's been relatively nice and steady, obviously with the medication. Now you've asked which app. That's a good question, but I am actually working with a company called AIDE, AIDE, to develop, we've developed a hypertension app for GPs and patients to be able to enter all their data in. So again, it's all about trends and not just taking one value in isolation. So, and also what I'm now doing is using this lived experience as a peer leader. So if we can move on, Lindsay. So I'm now a peer leader. I've actually was approached by Tracy to use my lived experience to help and shape and influence the healthcare and services and develop that. If we just move on, Lindsay, that would probably be the best thing. Thank you. So obviously my main interest within this, I've joined a group called Stronger Together in Wakefield, where all the peer leaders come together. And the two key things that I do show great interest in is obviously patient safety. I am a member of the patient participation network for GPs in Wakefield. I do tell my story, not to be negative, but to sort of show the effect of bad decisions can have on the patient. And I've shared my lived experience with a number of integrated care boards. But my real interest is in cardiac. I've helped use my influence to set up the cardiac support group in Wakefield. I do still volunteer at the cardiac rehabilitation, purely because I'm further down the journey than people who are just starting on the journey. I think it's quite good to see that actually there are good outcomes. You can have a good quality of life. Things will change, but you can go on and do what you want to do. And I've set up a peer support group, an informal peer support group called Wakefield Cardiac Buddies. It's a WhatsApp group. We meet for coffee once a month. We share experiences. People will ask, I'm going to be going in for this procedure, and people will share those experiences. And I've also been asked to be the peer leader within the Healthy Hearts Hub community health the Healthy Hearts community hubs, which I know Tracy and Gemma will be talking about. So next slide. And this slide will be repeated. So I won't talk anything about the Healthy Hearts hub, but as you can see on there, there is a peer leader, which is a key part of that structure. So I'll hand over to Gemma, who'll talk more about it, and I really appreciate everybody's time. What I will like to emphasize is high blood pressure doesn't necessarily need to lead to a heart attack, but also in the back of my mind was, I do wonder if I'd looked and monitored it for maybe 2 or 3 years beforehand, could this been prevented? Or maybe if somebody had explained to me the importance of the numbers. So hence the webinar today. So thank you, much appreciated.
Thanks, Sean, and thank you for sharing your story. I'm sure everybody found that just as inspiring as I did. I really appreciate it. I know it must be brave for you to keep sharing that story in a different context. So really quickly, Gemma and Tracy, before we come on to your session, Evan's going to have to leave us soon. So she's just going to quickly answer a couple of questions. And then rather than doing questions at the end, we will go straight on to the Healthy Hearts community hubs. What I will also ask is, Kirsty, if you can add the third Slido question, and then people can be doing that question towards the end as listening to Gemma and to Tracy. Thank you. So Evan, do you want to come in and answer those questions quickly, please?
Yes. So the first question was about whether peripheral artery disease is reversible. So I've answered that a little bit in the chat. And that is, it depends on the extent of the peripheral artery disease. As if you were to go see a specialist, you know, what they would recommend is exercise. The very thing that's very difficult to do is the very thing that you actually need to do, which is push through the exercise. The exercise forces blood flow to the, to your legs, to your lower limbs. So yes, it's painful, but it's absolutely necessary. Other things that you can also do include reducing. So you'll probably be prescribed things like antiplatelets to make the blood less sticky and hopefully flow better, and reduce the likelihood of clots that block things up. So you'll be prescribed antiplatelets. You probably also will be prescribed medication to lower your cholesterol as well, just simply because all those things do contribute to your risk, your overall risk of your cardiovascular disease worsening. But yeah, so it depends. Like I say, it depends on the extent of the peripheral artery disease, whether or not things can improve. But the hallmark of managing it, again, is those things that we've already mentioned. So your antiplatelet medicine, cholesterol medicine, and managing your blood pressure. But if you think about it as developing peripheral artery disease actually means you've now got what we call sort of symptomatic cardiovascular disease. So we're no longer trying to prevent one of those events. You've now got, an actual vascular disease that we now need to make sure doesn't result in things like a loss of a limb or developing a heart attack and things like that. The other question was whether high cholesterol was a risk factor for high blood pressure. Not directly. A high cholesterol increases your risk of you having cholesterol deposits in your arteries that make your arteries narrower. And obviously, if your arteries are narrower, it can result in a higher blood pressure. Alongside that, it also increases your risk of cardiovascular disease, because if you've got narrowed arteries, you've got deposits of cholesterol on your arteries, those are things that platelets can stick to, which makes the narrowing worse until you get complete blockage. And then you have, a problem, kind of like a heart attack, like in Sean's case, or, a loss of blood flow to your legs, if that blockage is in the arteries of your legs. So it's not direct, but what we tend to do, and I'm hoping this is something that they did for you, Sean, is when you've got high blood pressure, it's not just about treating the number. It's understanding what it means for your risk of developing complications. So yes, we will treat your blood pressure to reduce that number, but we'll also assess your risk of, complications down the line. So things like you heard, healthcare professionals talking about things like what we call Q risk. What that means is assessing your likelihood of developing cardiovascular disease in the next 10 years. So Q risk is usually a 10-year risk calculation. So your cholesterol levels will actually have an impact on what that risk would be. So chances are if you've got a high cholesterol, that will give you a higher Q risk score, which might then mean that we would want to take extra interventions to reduce that risk. So if you've got a high cholesterol, and that means you've got a high 10-year risk of developing cardiovascular disease, we might want to put you on medication to lower your cholesterol, as well as medication to lower your blood pressure. But again, it's got to do with that risk score. So it's not a direct link, but it does have an impact on your overall risk of developing a cardiovascular problem.
Thank you so much, Eben. I'm gonna have to stop you there. Thank you so much. We've just got Tracy and Gemma, who will quickly give a whistle-stop tour to the Healthy Hearts Community Hub. Apologies, ladies. I know you wanted 10 minutes and you've now got 5 at best. So just do your best with what time we've got left. Thank you.
No problem at all. So I'm Gemma Crabtree. I'm one of the lived experience managers as part of the NHS England Community Health Services team. And we've started a programme of work around the Healthy Hearts Community Hubs, which are hubs that are set up in the community, supporting people to take their own blood pressure. So if you could move on to the next slide, please. So I won't go through all of this, but this was an initiative that started in Canada and basically resulted in people lowering their diastolic and systolic blood pressure numbers through this community peer support initiative. So we've taken the nugget from Canada and worked it so that it works here in England, using, as Sean said, a peer leader, a person with lived experience of cardiovascular disease, working alongside a health and wellbeing coach. So next slide, please. This is the model that we've developed. So health and wellbeing coaches who are part of the R's roles, who have within their gift group working, working within community settings and working alongside a peer leader like Sean. So Sean has worked in the Wakefield Healthy Hearts community hubs, people coming together outside of a clinical setting, being given some self-management education. So talk to about stress, weight, alcohol, healthy exercise, etc. But then also, starting the discussion themselves, but being supported to take their blood pressure, and then that with consent being reported back to the GP or to the community pharmacist, whatever suits. The next slide, please. So there are 4 sites currently: Birmingham and Solihull, Wakefield, Dudley and Northamptonshire. These have started really well, and we're just waiting for more progress to happen across the 4 sites so that we can then expand it into other areas of the country. And we'll wait for those evaluations to come out to be able to inform what works best and what's best practice. But I'll hand over to Tracy, who will talk to you about Wakefield very briefly.
Hi, thank you. It will be very briefly as well. So if you'll just move on to the next slide. So that just goes over a bit of the rationale why cardiovascular disease prevention is really important, both nationally in Wakefield. And just to pick up on that slide, that in Wakefield, 15.5% of people have been diagnosed with high blood pressure. So that equates to about 55,000 people. The expected prevalence rates are around 30%, so there's probably the same number of people again that have high blood pressure that we don't know about. So it's obviously important that we do projects like this and work with it. Next slide, please. So move on to the next one, please, in the view of time. So the last one. So in Wakefield then, so we have partook in the Healthy Hearts Community Hubs. Because of links with Sean and Gemma, because we've got an established peer leadership group in Wakefield as well. So We have had really good engagement from our GP practices, so we're working with over 80% of them, so they're taking part. We've worked with each individual GP practice to develop a plan of what would best meet their patients' needs and preferences. We've had really good support from public health, and we've been able to purchase some blood pressure monitors, so if people comes to our hubs and their blood pressure is elevated, they can take a blood pressure monitor away with them, so we can start to develop that pathway and look at them being able to be diagnosed if that indeed is the case. We are supporting attendees to have really good conversations with our health and wellbeing coaches to really influence behaviour change, because not all CVD prevention is about taking medication. So a lot of it is about behaviour change and being given the time to really have a good personalised conversation. So we have launched our Healthy Heart Community Hub. So we had our first session in Wakefield earlier this week. The session went really well. So Sean and one of our other peer leaders supported that session. We had 14 people attend. It was held in one of our libraries. And we did highlight there was 4 people who did have elevated blood pressures at that event. So we're going to be able to start that treatment, start that sort of pathway to hopefully getting them remonitored and rechecked so that we can move forward with that. But in view of time, I think that's it. But I'm sure Laura will send out the slides after.
Thank you so much. There are just a couple of other links there. You will get the slides just to support you if you are checking your own blood pressure at home or for more information. So we will share. Thank you all so much for spending your lunchtime with us, and we will let you know when the recording is available as well. Thank you all, and enjoy the rest of your day.
Thank you.
Thank you very much.